Welcome to our webinar, which is a pediatric parent panel discussion. Thank you for joining us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of patients, families, and caregivers for supporting the program today. It is possible that you may lose your connection during the program. If you're unable to view the program online, you can call in to hear the audio portion using the call-in phone number in your reminder email. Our program today will be archived to our website within just a few business days. You will be notified by email when it is live and ready for viewing. This is a panel discussion, so throughout the webinar, please make sure that you're submitting your questions, and our panelists will be answering those questions as they come in. To submit your question or comment, just open the Q&A window in the lower part of your screen. Type in your question or comment in the small text box window, and when you finish typing, just hit enter. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do two things to help me manage the incoming questions. First, submit your entire question all at the same time. Second, I'd like to just mention that our panelists today are not medical professionals, so they will not be able to answer any medical questions. So please do not share private health information, as they cannot answer any medical questions related to healthcare. However, they will be able to provide and share their experiences. Our panelists today, we have Jessica and Travis, and we have Kim and Mitchell. Thank you so much for joining us today.
Thanks. Good to be here.
Yeah, so what I'd like to do is, if it's okay, I'd like for you guys just to take a minute or two, introduce yourselves, and then we'll go right in and answering all of the questions that we have. Kim and Mitchell, would you guys like to start first?
Sure. My name is Kim Ryan.
And I'm Mitchell. And our son's name is Mason.
Great. Jessica and Travis?
I'm Jessica.
I'm Travis. We have two daughters, Megan, who is 9 now, and she was diagnosed with aplastic anemia, and a younger daughter, Eleanor, who is 7 right now.
Thank you. So Kim, tell us a little bit about Mason.
Well, Mason is 9 years old now. But he was diagnosed with myelodysplastic syndrome at 15 months. So he originally was born with a blood disorder, and they told us that it would clear up, but if it came back, it would be cancerous. And at 15 months, unfortunately, it did come back. And he was diagnosed at that time with leukemia. But as we did his spinal tap, we found out that it was myelodysplastic syndrome. So we spent about 6 months in the hospital. We followed the AML protocol. And after the 6 months, he was in remission. So we've been in remission for the past 7 years, and he's doing great. He's a 4th grader now in elementary school, and he's doing well.
Thanks so much. Jessica, would you like to tell us a little bit about Megan?
I delegated Travis to do that.
Okay, go ahead, Travis.
So he's gonna talk about Megan's story.
Sure. So Megan was 7 and she turned 8 in April of 2021. And the only thing she wanted for her birthday was her ears pierced. So my wife did a lot of research, found the perfect place to get her ears pierced. It was like a tattoo place, didn't want to get the gun. So anyway, got the ears pierced. A couple days later, we noticed that, she had weird bruising behind her ears. And it's pretty typical with an aplastic anemia story is to notice kind of the bruising first. So, for me, I would easily write it off to the kids were playing rough. But, credit to my wife, she was like, no, this isn't normal. So long story short, we took her to her pediatrician, said it's not normal. They did a CBC, said go immediately to the hospital. We were there and, they said, look, it's probably leukemia, because that's what they look for in a lot of these cases. And a couple bone marrow biopsies later, they're like, it's not cancer. And you get that, hey, great, it's not cancer, but what is it? And then aplastic anemia. So we had to learn a lot very quickly about a very rare disease for our child. And this was all in April of 2021. For us, we immediately had our younger daughter, Eleanor, tested to see if she was an HLA match, just, to have the option to do a bone marrow transplant. Unfortunately, she wasn't a match for us. We talked to the doctors about what our options were. Megan kind of fell into that very severe aplastic anemia category. She basically didn't have any neutrophil count at all. So we made the tough decision to do an upfront bone marrow transplant, because we were extremely fortunate to have a lot of great matches on the bone marrow registry. So we went through with a bone marrow transplant on July 13th of 2021, and today is day plus 505, and Megan is doing great as a normal fourth grader. And we're actually going to meet our unrelated donor in person this Friday. So it's very exciting.
Yeah.
Oh, awesome. That's wonderful. That'll be an exciting meeting.
We've met on Zoom
All
a
of
couple
you.
times, and she is the nicest person, as you can imagine.
Yeah.
Any bone marrow donor would be, and we're extremely excited to meet her.
Great. Thank you for sharing all of that. Kim and Mitchell, how did Mason end up getting diagnosed with pediatric MDS? What kind of led you guys to the diagnosis?
Well, when Mason was first born, his blood work came back abnormal. And so the doctors, they kept, checking it, and they said it would clear up, and it never would clear up. And they finally told us it's a long term, but he had a blood disorder. And so we followed that for, we would go to hematology every month, check his blood work. We go every 2 months, every 3 months, every 6 months, and then at the 6-month mark, they were getting ready to release us for a year. So everything had cleared up and he was doing well. And right before Christmas, his platelets had dropped dramatically. And so they told us, go enjoy Christmas. Maybe he's, ill, and we'll check it the next week. And so we checked it the next week, and they were still down. And so that's how we got the diagnosis for leukemia. And then about 2 weeks later, we went to do the spinal tap. And the spinal tap didn't show leukemia, but it showed myelodysplastic syndrome. So that's how we found out about Mason.
And what did they tell you pediatric MDS was?
To be honest, we had no clue. And they told us it was they told us that the percentage of abnormal cells in his body wasn't enough to call it leukemia. And I think he was at 9 or 10%. And so that's where they told us it was myelodysplastic syndrome and not actually leukemia. So that's really all that they told us. And we, just not having the experience of going through this, it was a total shock to us. And we really I don't think we grasped at that time, about myelodysplastic syndrome, and that, I don't think we grasped it well at that time.
Thank you. Jessica, Travis, what did the doctors tell you aplastic anemia was?
Well, when Meg first got admitted to Children's Hospital, they were really looking for a lot of different things. And I would say it took about a month before they officially diagnosed her with the aplastic anemia. And basically what they told us is that her bone marrow was failing. So, she was transfusion dependent on blood transfusions and platelet transfusions. And they, at the time, had given us 2 different courses of treatment options. The first was immunosuppressive therapy, and then the second was the bone marrow transplant. And we had that tough decision to decide which route we wanted to go.
And, I think one of the hardest things up front was kind of getting that finite diagnosis, like Jessica had mentioned. I mean, right off the bat, day one in the emergency room, we had a great doctor, and he said, look, it's either going to be, leukemia, aplastic anemia, or post-viral infection. He says, don't think it's a post-viral infection because, you know, what you've been telling me, your daughter hasn't been sick. So he's thinking, you know, leukemia or aplastic anemia. So, you know, as soon as they did the bone marrow biopsies, it didn't see any blasts. We pretty much knew there, you know, it was aplastic anemia pretty much on day 2. Unfortunately, there was a lot of, you know, things to roll out just to ensure that diagnosis. So, you know, to all the parents who are out there now, like in that beginning phase, that's one of the toughest parts, is just kind of waiting for test results and just kind of that spot to get to that finite diagnosis. Well, like I say, because even though we knew kind of up front, it was, you know, waiting just to get that 100%, here's what it is.
Just, did you guys consider getting a second opinion, even when you got the diagnosis? Did you?
We talked to a lot of
Yeah.
people. We went to Children's Hospital. We talked to Johns Hopkins. We talked to another, we were connected with another woman who worked at NIH with aplastic anemia.
Spoke with Dr. Marvel, Milwaukee.
Milwaukee. I'd say
you
we
know,
probably got talked to 4 different specialized groups on this.
and I will say, you know, one of the things for me personally, and for us personally, I should say, is that it felt very isolating to have a child with a very rare disorder. But what I will say is that the people who we've talked to, as far as in the medical profession, were unbelievably generous with their time. So while we didn't get an official second opinion as far as getting to, you know, several doctors' offices with Megan, I mean, it was the pandemic as well. The people we talked to on Zoom and throughout their time were just extremely generous, and we got so much information just by doing it that way. So it was great.
Thank you. Mitchell, Kim, did you guys get a second opinion for Mason's diagnosis?
No, we didn't, but we got a whole lot of information from the doctors, and it was more like Twilight Zone, like, is my son going to be okay?
Yeah.
So it's like, okay, like Kim just said earlier, we didn't really grasp, you know, the total meaning of what he had, but, you know, it's more so, is he going to be okay? What do we need to do to make sure he's okay?
And I think that I was going to say, I think the fact that we were already in hematology, oncology, because of the blood disorder he had, you know, we had developed that rapport with that group of doctors, and we felt pretty confident, you know, once we did get the diagnosis, you know, to work with them. So we really didn't seek out a second opinion.
Yeah, and I think that's actually important too, is when you feel comfortable with the medical team that you're with, and you get that feeling. You know, at first, I think, you know, when we were at Children's Hospital, there was, you know, doctors that we're dealing with, and then when we finally met, you know, our ultimate doctors who we went for the bone marrow transplant, we felt so comfortable. We're like, okay, these are our doctors. Didn't need a second opinion, you know, because these are our people, and we felt good.
Yeah.
That's great. You know, there's a comfort level in being able to trust someone outside of your own family to be able to take care of your little one.
And they dealt with all the million questions that I had. So everybody was asking millions of questions, and they tolerated me, which was great. So I appreciated that.
Absolutely. And speaking of questions, how did you develop the questions that you wanted to ask? Especially when you're told that your child has a rare disease that you've never heard of. How do you kind of figure out those key questions that you should be asking? Jessica, Travis, you guys want to take that one first?
Sure, I can take that one, since I asked too many questions. You know, how do you develop those questions is an interesting part, just because, you know, you don't have a basis to start with. So, you know, I'm an analytical person by nature, but I like to ask a lot of questions. So I would ask any question that came up, and any question that I asked could lead to more questions, or it was just kind of about that learning process. Because, you know, I really saw, as you navigate, you know, the medical field or the medical system, that, you know, you have to learn, you have to advocate for your child. You have to not be scared to ask those questions, because, you know, we were extremely fortunate in a lot of ways in this, and you know, we were able to ask those questions. And it just kind of also makes you realize that some families aren't able to ask those questions for various reasons, and it's unfortunate. But you have to ask any question that comes up, no matter how stupid you think it is, just to learn and to advocate for your child, because I think that that's kind of the mode that you have to get into.
Kim Mitchell, how about you guys? How did you develop the questions that you wanted to ask and keep on top of things? Because that can be very challenging.
I mean, I think kind of what Travis said, we asked anything that came to mind. Like I said, we were not very familiar, so anything that popped in our heads, we asked. And I kind of kept a journal when we got in there. So anytime, I tried to every day write down what was going on with Mason, what things occurred that day, so I could recall, if for any reason we needed to go back and have that. So I kept a little journal. I did a blog to help others, family and friends, understand what was going on. So that's kind of how we dealt with that.
I kept a notebook too, where I would ask questions and write it down because I felt so overwhelmed that I was like, I'm not going to remember this. He's got a different memory than I do, where he was able to retain it. But I was like, I need my little notebook there to write stuff down and ask the questions so that I could refer back to it later in the day if I needed to.
Kim Mitchell, this question is for you. Other than transplant, were you offered any other treatment options for Mason with the pediatric MDS?
Not to my recollection. We were just they may have, the first step was to go with the chemotherapy. And so we went with that, and it was successful, so we didn't have to really pursue any other options. So that was the course that we chose.
Thank you. Jessica Travis, with aplastic anemia, why did you go with transplant versus the ATG?
Do you want to answer? Or?
You know the percentages better than I do.
But look, it's an individual decision for every family. And for us, Megan's neutrophil count fell off a cliff and she was extremely neutropenic. And, that was one factor. So we had kind of a window to, how do we, move forward with this? Secondly, we were fortunate enough to actually even have the option of a bone marrow transplant. So, I know that there are so many families, too many families actually, who don't even have that option because there's a lack of good matches on the registry. So for us, we had the fortune of making that decision. It was the hardest decision of our life. We did a lot of research and we figured out what was the best thing for our family. And as I've gone through this journey and I've talked to a lot of other families about this, what you realize is that, the decision that some families make is right for their family, and decision other families make are right for their family. Just because one person did it one way doesn't mean that that's not the right decision for another family. One of the things that I talk to up front to a lot of people is that try to stay away from social media and the Facebook groups of a lot of these diseases, because you tend to focus on sometimes the extreme cases, the good or the bad. And what you have to realize is that the decisions that those families make have zero bearing on you and your individual family. And so what you really have to think about and do is, yes, those are data points, but your family's journey and your family's decision is individual to your family. And that's kind of how you have to make the right call. And so for us, because we had that option, because Megan got so sick and was so transfusion dependent, the right decision for us was to, do an upfront bone marrow transplant. And again, we consulted a lot with the doctors at Children's Hospital about doing it, and they agreed that it was the right decision.
Thank you. Did you guys involve Megan in the process? Was she kind of part of the decision? How did you
she was
be part of the process?
She was 8, and a lot of the times that we had these conversations were times that she had to be admitted to the hospital, and so she would overhear conversations that we were having with them. She's pretty smart and intuitive and asks a lot of questions like we both do. So, I think it was more of after we weighed the different options and what the decision was going to be, we would talk to her about that. I had to have the conversation with her about, she was going to be having chemo and radiation. She had hair halfway down her back. So having to talk to her about, I cut her hair before her transplant, about how she was going to lose her hair. And, she took it a lot better than I did when it actually started to fall out, actually. And, it was just communicating with her, not necessarily, I would say, give her that decision, but more of, this is what's going to happen. This is, what you're going to be going through, and, how to support her through all of that as well. And, we're very fortunate to have, FaceTime, so she could FaceTime her sister and, her tablet, and be able to stay connected with her friends and family that way too. So it was just setting expectations for her at an 8-year-old level.
Yeah. And also, speaking of the decision, I mean, the doctors wouldn't tell us, here's what you should do or here's what you shouldn't do. And to a certain degree, I will admit it was frustrating, because I wanted them to tell me, this is the course of action you should do. And they didn't, right? And thankfully, they didn't. They left it up to us. Frustratingly, it was frustrating at the time, but I'm happy in retrospect, because what it did was it allowed us to talk to other people and to get more information and to figure out what the right choice was for us. And I think that, had we been in a different position and the doctor said, this is what you need to do, let's do it, we probably would have been like, okay, because we were, you're in such a different mode than, especially early on in diagnosis, you're just looking for something. But, I would encourage everyone to, talk to, whether it's another family, whether it's another doctor, whether it's something else, just to get information about what your options are, just to learn a little bit more, that can help you make that informed decision.
Thank you. Kim and Mitchell, how old was Mason when he had his transplant?
He didn't have a transplant. He started his chemo though at 16 months.
And how did you guys manage all of that, trying to keep a toddler down?
It was rough. I mean, he at that point had not, he wasn't walking yet, but he was just all over the place. And so our biggest issue with him was just movement. He had
all the tubes
on him. And I mean, that was our biggest thing, was keeping him still. And I mean, it was hard. We had several times where he pulled out the tubes and we had to go in and do surgery, again. So I think that happened 2 or 3 times. And that was the most nerve wracking, because, he's 16 months and going under, doing the surgery again. So it was really just a matter of just keeping him busy. At 17 months, he learned the iPad. So he learned early how to use the iPad. It was just really I mean, that was definitely a challenge at that age. I mean, hindsight, if he had to go through it, I would rather him go through it at that age than, his age now. Because, he had no clue. And, so he didn't, I think as adults, we bring in preconceived notions, but as a 15-month-old, you don't know that it's supposed to hurt, and you don't know that it's supposed to, not feel good. So he was a little trooper, going through the treatment.
You never would have known he was going through anything. He was always smiling, laughing, and playing. He really didn't get sick, maybe once or twice, but you couldn't tell he was going through anything except for all the wires and stuff coming out of him. And he was like the little mare because he learned how to walk in the hospital. He was zooming on his little walker and, saying hi to everybody. And so in one sense, that was a blessing, but, it took our minds off of what he was going through. So he was really helping us get through this process more than I think we helped him.
They're really strong, I tell you.
They are.
How long was Mason in the hospital for?
So he was in the hospital. We went in January, and our last day in the hospital was July 31st. So it was right at 6 months, like they told us. So, he'd do the chemo, we'd watch his numbers go down. They would wait until his numbers would come up and they would give us, maybe a week at home so he could recover. So we could do it all over again. So it was, 6 cycles of chemo that he did. And after, at 6 months, we were able to go home for the last time.
And how did you guys kind of manage being in the hospital with, other responsibilities? Did you have family support, friend support?
It was really just the two of us. We do have family here, but the time that we were in the hospital, they weren't allowing visitors because the flu was so bad at that time. So we really couldn't get the support because of that. We both moved into the hospital, especially at his age, and we pretty much lived in the hospital with him. We were able to work it out with our employers to where I worked 3 days a week and Mitchell worked 2 days a week. So we would rotate. I think I was Monday, Tuesday, Wednesday working. Mitchell would work Thursday, Friday. And so, one of us was at the hospital with him at all times.
And that was just a blessing that we were able to do that, because it was a whole lot of kids in the hospital without their parents. And that was hard to see too. And you think you have it bad, but that was a struggle.
Yeah. Jessica, Travis, and how long was Megan in the hospital after going through transplant?
So after transplant, she was in the hospital for 6.5 weeks. But we weren't able to leave. We had to live at the hospital that entire time. She was in an isolated wing at Children's Hospital, the bone marrow transplant wing. And so we were able to both basically move in and live there that entire time. My parents live very close to us, and we were very fortunate that they were able to take our younger daughter with them for the 6 weeks. It was during the summer break, so that did help in the sense of not having to worry about her going to school. But I don't know how we would have done it without my parents, to be able to take our other daughter, because she lived there and we lived at the hospital with Megan. So that's when we knew, we were just very fortunate to have them to help us out with that.
And how did you kind of manage with your other daughter? Because I'm sure this was very, very scary for her too.
Yeah,
Being away.
There, it was be FaceTiming or I think over the 6.5 weeks, I think, he and I came home I maybe came home like 5 times, just to do laundry and pick up stuff. And I would always stop over and see her. And, she, was always such a strong kid as well. Like she was always Megan's biggest cheerleader. And I mean, she's actually doing cheerleading now. Like that's her thing. She loves it. And she just knew that her sister was sick, that she had to be in the hospital. We refer to it as the long hospital stay in our family. So it was just something that, she understood as much as she could. She was 6 and she,
Yeah, I mean, part of the key was, making her part of Megan's team, right?
Yeah.
And just to say, this is the role that you play. And it's hard to talk about a lot of these things, especially with young kids. But, if you can talk to them about it in their terms, and explain to Megan, this is what's going to happen and you're getting your bone marrow, and explain to Eleanor that your sister has to go on for this long hospital stay. Here's what you can do to help. We spent a lot of time pre-transplant in the hospital talking to our kids about that. So I feel like it kind of helped ease that transition a lot, because they knew what to expect, and they knew, well, I guess nobody knows what to expect, but at least to, have that conversation and communication, I think helped a lot.
How was the transplant process? How did Megan feel about the transplant process? Because there's a big build up, to the day. And then when the day comes, it's like, Oh,
It's a little, honestly, it's a little anticlimactic in the sense where, it's having aplastic anemia. A lot of children are transfusion dependent, Megan included. It's just like any other transfusion. Obviously, it has extremely special meaning, but it's just a bag that they hang that has magical cells in there. But the transplant itself, I think, for us, was great. It was a blessing. Megan definitely dealt with the side effects of the chemo and the radiation that came along with it better than we did, in the sense that we told her what was going to happen. She's going to lose her hair. And I remember at one point, she was laying in the hospital bed and she's like rubbing her head on the pillow and her hair's falling out and she's laughing. She's like, look, my hair is falling out. This is hilarious. And,
Well, I go to the bathroom to cry. But it's
but again, we talked to her, this is what's going to happen. Well, we don't know what's going to happen, but we said, here's what we're going to expect. We're expecting, it's transplant, hair to fall out, you're going to feel sick, it's not going to, here's what it is. And I feel like because we talked a lot up front with her about those things, it helped in that, Megan looks at it now in the sense of like, oh, I went to the hospital and got new bone marrow. And we were to some degree worried, about the trauma that she would go through for something like that, because as parents, and I'm sure Kim and Mitchell can attest to this, it's a lot of trauma. It's a very traumatic event to go through. And as adults, we process trauma in one way. But we had Megan talk to, some child psychologists to make sure that, she didn't have residual trauma. And, one of the blessings about children is they think about things in the way a child thinks about them, right? They don't have this sense like we have as adults to think about, what could have been, the past, the future, all of the different possibilities. They process it like a child processes it. So we tried to have Megan in that same mode and, okay, this happened. I live in the moment. Now I'm here. Now I'm back in school and everything is kind of back to normal. So that helped a lot that she was able to process it. But again, it was because she's at a younger age. As children get older, it's a different story, but we were fortunate in that regard too.
Mitchell, Kim, what type of side effects did Mason experience, and how did you guys manage those side effects with the chemotherapy?
He did end up losing his hair towards the end. So he made it through a lot of the treatment, with hair. You could see it kind of thinning. So he did end up losing most of it towards the end of the 6 months. And that's really, and at his age, it was hard for him to tell us, what was going on with him. And that's the biggest side effect that we saw. Now we're in long-term care treatment. And so we go once a year to check his blood work. And every 2 years we check his heart. So with one of the chemotherapies, it affects your heart after, after, taking the chemotherapy. So every 2 years we'll do an echocardiogram, just to double check and make sure that his heart is doing well. So those are really, the hair loss was the biggest side effect. It did make him sick, so he was, he had some days where he was
not as energetic.
Yeah.
That's when you could tell something was wrong. Mm-hmm. But he really didn't display it all the time. So like I said earlier, it was just a couple of times where you like, oh, and you can't do anything to make it better. But that was Mason. He was just a ball of energy. So once he went moving, you knew something was kind of wrong with him. But most of the time, it didn't affect him as adults think it should. When you say you're supposed to be getting sick, we couldn't tell, but a few times. But
thank you. And Jessica and Travis, what about the side effects for Megan, and how did you guys kind of handle side effects that she was going through?
Yeah, some of the immediate side effects in the hospital were, obviously hair loss. She got nauseous. I remember specifically. So, she had a nose tube, feeding tube, and NG tube, as all kids, or pretty much all kids have. And I remember the first time Jessica decided to, go home and do laundry or relax. That night in the in the nightly bath with the nurse. And of course, that's when Megan throws up, right? And she has that first bout of nauseousness and the NG tube comes out. And Megan does not like sticking stuff up her nose. So it's like that whole freak out moment of like, oh no, like, what do we do? The NG tube. And so, there was some nausea associated with it, but, there specifically in the hospital, there wasn't a ton of side effects that we saw there.
Well, I would say some of her medications though, because she had to be on a ton of different medications, and one of them being cyclosporin, which is a suppressive medication. And one of the side effects with that actually is hair growth, but hair growth in different places like your face, your eyebrows. She was fuzzy. She was very fuzzy in general. So that was something that we saw. I mean, sometimes her gums were swollen, so it was tough for her to eat. She lost weight because of that.
Yeah, I mean, that's a great point. I mean, it was a lot of, some of the prophylactic medications or immunosuppressive drugs that had more, I think, side effects in our situation. So, but again, similar to Kim and Mitchell, we're still going through long-term follow-up treatments just to, measure any, organs, things like that, just to make sure everything is kind of developing as normal.
Mm-hmm.
So we have a question. What questions do you wish you would have asked? Looking back, were there questions that you feel that you wish you had asked throughout the journey so far? I'll give you a minute to think about that. Whoever would like to take it first.
Yeah, so one of the things that this is not a question to ask up front. So, I'll be the first to say that every question that probably existed, I probably asked. But one of the things that I wish we had probably as far as answers or maybe a good question to ask would have been, for us, what to expect as parents,
expectations.
How do you prepare for that hospital stay? We wish we would have had somebody that could kind of tell us, hey, look, when you're in the hospital, here are the important things to pack. And I think the hospital, they give you the booklet and it tells you a lot of things. I think for us personally, what we try to do to help others now is to say, hey, look, you got the booklet. Here's what you can expect at the hospital. Here's how you can make your stay more comfortable. Here's, what to expect as far as rhythms in the hospital. So, while this maybe isn't a great way to answer that question, the question we should ask up front, but one of the things that I wish we would have probably spent a little bit more time for had, somebody to help us with is to, hey, look, you were in the hospital for 6 weeks for a transplant. From your parent experience, what are the things you packed? How did you make it more manageable? How did you deal with your other kid? Having that support is probably something that would have been.
What did you do when you got home?
Like
you have to start learning how to basically be a nurse for your kid.
Yeah.
And that was not something I ever really expected to have to be able to do.
Yeah.
I think I would agree with the expectations.
But, I think for us personally, because we see that's one of the things that at least helps inform us of, how to help other people who are in similar circumstances to maybe help ask some of those questions, to answer those questions for them up front, just to help guide them through. So.
Mitchell, Kim, how about you guys? Is there anything looking back you wish you had have asked that you didn't?
Not really. I think Travis kind of said
it. Sorry for that hard question.
Expectations. Because when we did have questions, we asked them, and
yeah,
I think, yeah,
and that's hard, right? I mean, it's hard to think about the questions you should have asked, and I kind of chalk it up to, just being open to asking some of those questions, and don't be scared to ask the questions, as they come up, or even to seek out a support group. I remember specifically, I went into a pediatric, aplastic anemia support group, monthly support group, and I was expecting to be like the person that can kind of stay without my Zoom, and it was going to be this big group meeting, and thankfully it was, Pam and Cyber were there, and they're like, Travis, how are you doing? And for me, it just made it feel like it was such a blessing, because it made me feel so much less alone. So one of the things, this is not answering that question, but one of the things that I think is helpful to ask and answer those questions is to, find a group, right? Make sure that you're not feeling as alone, because I can be the first one to tell everybody in this that while having a child with a rare diagnosis is extremely isolating and you do feel alone, you're not alone. And there are people who are out there who can support you, including us. I always am the one saying, anybody who wants to reach out to us, please do. We're here to support you. You're not alone. And we're all in this with you. So.
Thank you guys. So I have another tough question. It's about dealing with the staff in the hospital. And the question is, the medical staff seems to rotate the nurses every few days. How did you guys manage the rotation of the medical staff, not having the same people consistently? How did you communicate with so many different people?
You go ahead.
Go ahead, Kim.
For us, it was actually a little frustrating. Going into this process, I didn't know too much about nurses, but nurses became our best friends. They helped us through so much. Some nurses were better than others, so we really developed relationships, with the nurses. And they were really our go-tos. The doctors rotated. We saw them maybe once a day during rounds, and it was really the nurses that kind of, kept us going and, was able to help, Mason out with, with things that were going on at that time. Do you have anything?
I think that was the biggest part. We, building relationships, because you saw them nurses all the time. And yes, they rotated and it was different, but we were in the hospital for so long that, it was routine. We knew their schedule probably better than they did. We knew who was coming in and that sort of thing. But building that relationship, talking to them, communicating, like Kim said, they were our go-to. If we needed something, they jumped on in it. We'll take care of that. We'll get the doctor, whatever we needed, they were there. So yes, at the beginning, it was kind of a little frustrating because you didn't know who was going and you were already in the twilight zone anyway. Your kids in the hospital, what the heck's going on? But the nurses were our rock. Which helped us out tremendously.
We're still friends with a lot of it was probably 15 to 20 nurses that rotated, that we saw during the 6 months, and we still stay in touch with a lot of them. So,
yeah.
So highly recommend that, develop that relationship with the nurse.
Yeah, I can't agree with that anymore. I mean, it is frustrating to have kind of, an ever evolving rotation of nurses, but look, you can't control that. And when you're in a situation, having a sick kid, sometimes you try to control things that you can't control, and you have to learn not to. And
Right.
Having this constant flow of nurses is something you can't control. But what you can control, like Kim and Mitch were saying, is the relationships that you can develop with them. And not all of them are going to be your best friends.
Right.
But all of them are there to help treat your child, and all of them there are in the best interest of your child. So, keep that in mind, and they're people too, and just kind of treat them with respect and ask them questions and develop those relationships. And I think that helps tremendously.
This question is for Jessica and Travis. Did the transplant team give you information about what to bring to the hospital, like things that you were allowed to bring, things they suggest you bring, and how to prepare for home life afterwards, like things that you should do to prepare for Megan to come home?
Yes, but before the transplant, they gave a booklet which basically described everything in it. It just talked about, the treatment, things to bring. And there was a list of what you could bring, what you can't bring, and as I mentioned, it's an isolated unit, so everything had to be packaged. We couldn't just bring, everything had to be wiped down. We couldn't just bring in like a dirty stuffed animal or something like that. Or we couldn't bring in books. It was very specific of what we were allowed to bring and not bring. And then the nurses and the doctors did go over before she was discharged certain things that we could and could not have at the home. We had to have our room cleaned before we got back. Having to clean the counters every day, plants. We didn't have our dog with us. Our dog stayed with my parents for a long time, even though you can have pets, but there's just certain things that they recommended you have and not have. And they did provide us all of that list of everything.
And look, it was extremely helpful. And I made the comment before about, knowing to expect up there, and they can give you the information, and, it's a book and it was probably somewhat a bit outdated. So obviously there are inherent problems with, giving you that information, it evolves over time. But I kind of chalk it up to, it was great because it was a very, you learn things in school in a textbook, and that was like giving you the textbook of here's what to learn. But there's a difference between, having somebody else who went through it to kind of, maybe teach you or talk to you about some of the minutia details when here's what to expect, or, Tuesdays and Thursdays are bingo, and this is how you can do it that way. Or, here's the size of bins that fits perfectly in there, and you can buy these at Target, and this is great. Or, so
Yeah.
some of the details I think would have been helpful, but again, the hospital is extremely helpful as far as what they would have providing, can bring, can't bring, and, how to do stuff at home.
And when you came home from the hospital, and Kim, for you and Mitchell as well, did you have to prepare the house for Mason coming home? He'd been through chemotherapy, so your resistance is down. Did they give you guys a way to prepare home to make sure that it was safe?
Not that I recall. We took it up on ourselves to keep Mason kind of away from people for a while, until we got the okay that it was okay for him to be around, larger groups of people. Like I said, I don't recall them, not that they didn't, but I just don't recall.
Yeah.
Travis, how about for you and Jessica? Did they give you some tips on how to prepare your physical home for when Megan came home?
Yeah, I mean, we were obviously, it was the height of COVID, and we were very concerned about like how much do we have to clean, how much can we have people over. So they told us obviously clean, make sure things are sanitary, but you don't have to go overboard, right? So I think sometimes there's a tendency, and I'll be the first to admit that I was like that too, to go overboard as far as keeping things clean and everything else. But they gave us great tips as far as things to stay away from, as far as bringing plants in the house or other people in the house, or just kind of staying away from sick individuals. So there was a lot of guidance that was there to help with that. But yeah, it was a little bit different of story. It was COVID, so
Yeah.
And Travis, has Megan started the revaccination process yet? And if so, how's that going?
she has. So when she weaned off of immunosuppressive medication, cyclosporin, we had her kind of restart her childhood vaccines again. So she started in February of this year getting her vaccines, and we're on a pretty regular schedule for I think the next 6 months at least. At first the vaccines are administered, in the clinic, and then eventually the vaccines get administered through her regular primary care physician. So everything's going great, as far as that.
Great. Kim and Mitchell, this question is for you. This is from a parent whose daughter has pediatric MDS. And they say you mentioned about Mason having yearly checkups and then every other year for cardiac. Is that lifelong?
Good question. And we asked that question, and pretty much they told us it would be lifelong, that we would have to. I'm not sure about the echocardiogram, but definitely the annual checkup. They said to expect to continue doing that.
And with having to have the echo done and have the heart disease, does Mason have any limitations on what he's able to do?
He does not.
And would you like to talk about how you guys do a 5K run? And I know Mason participates, so I think this will be very helpful.
Yeah. So quickly before, I mean, because of our just what happened to us and our time in the hospital, we were just so grateful to the doctors, to the nurses, you know, for just everything that we went through. So we started a foundation. It's called the Bowley Gold Foundation, and so, you know, we just want to, you know, just like Travis mentioned, we want to help families as much as possible, you know, as they go through the process. And so every year we do a 5K. And it's actually called the See Mason Run 5K because Mason loves to run. And every year we weren't able to do it in person because of COVID, obviously, the last 2 years, but we restarted it this year. And, you know, Mason he's like the little, what do you call the person that's at the very beginning of the race? I can't think of the name, but he's, you know, out there getting his run on, and the ambassador. He's like the ambassador for it. So, but he's doing, you know, physically he's doing well, and has no limitations.
And we're raising the money to help families that are in the hospital. And a big part of that is when parents couldn't be at the, you know, have other kids at home and couldn't be at the hospital. And, you know, it was more so being able to give back to them families that needed help, even getting a babysitter or, you know, food delivered to them, or whatever the needs were for them families. And that's our goal. And that's what we're, you know, shooting to try to help and, you know, ease some of the stress that are on the families.
And Travis, how about Megan? How is she doing now? And she back to normal routine? How are things going?
Yeah, I mean, she's doing great. You know, we were fortunate. It's interesting, you know, going through a bone marrow transplant during COVID. You know, it's scary, right? But at the same time, there's a lot of advantages to it that you don't think about. Like, we had options where she could do virtual school. You know, a few years ago, we wouldn't have had those. So, you know, with her, as soon as we got home from the hospital, we were able to have her in virtual school and have that sense of normalcy still for her, even though she was at home, you know, and other kids were actually in person. We at least had that option. And the same thing for, you know, myself and Jessica, we actually had, you know, work remote options, right? Which were great for an immunocompromised child, you know, because our child was immunocompromised. So, you know, for us, you know, it helped preserve a little bit of that normalcy. And so, you know, Megan was just excited as soon as she was able to go back to school, as soon as she weaned off the cyclosporin. And you know, I was probably a little bit hesitant, and the principal was like, hey, let's do this on Monday. And I'm like, okay, let's do it. You know, and at first I wasn't sure, you know, her hair was still short, and the kids, you know, she was the virtual kid. So I think a lot of kids knew what was going on. And I was concerned. I talked to the child life specialist, and I was like, hey, you want to come and talk to the kids about what happened? And we're like, yeah, that's a great idea. After a week, Megan's like, no, I'm okay. You know, and she just kind of wanted to be a normal kid. So for her, you know, it was almost like she was able to get back into that routine, like almost immediately after going back into school and seeing her friends again in person. And I think it speaks to the resiliency of children. Now, obviously, different children at different ages or have different levels of resilience, but we were fortunate enough, you know, for, you know, she was 8 at the time and turned 9, but, you know, for that age that she was resilient, she looked at it as something that, you know, she went through, had to get new bone marrow, and, you know, now she's back to being a normal kid and doing normal things. And, you know, when we talked to, you know, our psychiatrist who talked with her, you know, she said the only residual thing that Megan has is that she wants to be a doctor now. And that's not a bad result of, you know, something that we went through. So yeah, to answer your question, Megan's doing great. You know, and me as a parent, it was hard a little bit to get back into the normal things, to watch her ride her bike for the first time after she was home from the hospital, or, you know, catch a cold for the first time, you know, after she got home from the hospital. But you have to, you know, have trust and faith that everything's going to be okay. And, get back to that sense of normalcy. And I think it helped a lot.
So Travis, will stay with you. This will be our last question. What is your best advice for newly diagnosed parents of a child with bone marrow failure?
That's a great question. My advice is I have several pieces of advice that I like to talk about a lot. And anybody who's been in monthly AMDS Pediatric meeting, you've probably seen me or heard me talk about this. But the first thing that you should know is that you're not alone. Because I know it is very isolating to have a kid with a rare disorder, but there are others who are out there to help support you in any way possible. So reach out if you need that help. Secondly, like I mentioned before, be wary of social media and kind of Googling things, because again, sometimes you're seeing the extremes there, the good and the bad, but what you have to realize is that, those don't have any bearing on your own family's circumstance and situation. It's hard to do. And I think we've all kind of been there in that spiral, but as much as you can, try not to be there and learn to control the things that you can control. And third is just to, make sure that ask a lot of questions and leverage, some of the resources that you have around you, whether it be these support groups or the AMDS website. Reach out, ask questions, and don't be scared to it. And, I'm always here to help support anybody in any way that I can and use those resources. So.
Thank you so much. And Kim and Mitchell, what's your best advice for newly diagnosed parents of a child with bone marrow failure?
Well, if I can steal some of Travis's, he really hit the nail on the head. Finding a support system is really important. Like I said, we had our family here, and we also had, support at the hospital as well. So, having that support, building relationships with your physicians, with the nurses, was very helpful for us. Stay away from the internet. You can really freak yourself out by going down that rabbit hole. Just talk to the doctors, and don't go down that rabbit hole. You have anything?
Yeah, Travis and Kim said it. But it's definitely will be a whirlwind, and just believe in your kid that your kid's gonna push through that, and they're a lot stronger than we think, a lot stronger than us, and just talk to the doctors, get that information you need from them. And like they said, stay away from the internet because it's the extremes. And in your case, is totally different than everybody else that's on the internet. So just focus in on your case and what you, like Travis already said, what you can control, and stay focused on that, and what you can control and do something about.
I have one other thing to add too, and that's taking care of yourself as a parent. Because you're taking on your kids' troubles, you're concerned about your kid, and take time for yourself. I know one thing I did when I was in the hospital is I would go for a run. We were both there. I would go for a run to clear my head, to get rid of the stress. And whatever it is, whatever you can find that can de-stress you, that can get your mind off of it, that can at least get you away just for a little while, do it, because that was something that really, got me through the process.
Well, thank you so much, Kim, Mitchell, Travis, and Jessica, for sharing your time and your expertise with all of us today, and sharing your family stories to be able to help others. Because as you said, this can be a long journey and a difficult one. And it's nice to know that you're not alone, that there are people out there that are here to support you and your family. So thank you so much for sharing all of your wonderful wisdom and your stories to be able to help others. And if you'd like to watch this webinar again at a later time, it will be available on our website within just a few business days. If you have any additional questions, please feel free to email us at help@aamds.org. Give us a call at 800-747-2820, or you can submit your question to our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us and making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 39 years. This concludes our program. Thank you all so much again.
Thank you.
Yeah.
Bye.
Bye-bye.
Bye.